We're visiting Virginia Family Dentistry. I'm here with Dr. Tyler Perkinson. It's great to meet you.
Oh, it's great to meet you too.
Thanks for having us here in the practice. I've got a question for you to start, which seems like it's going to be a little counterintuitive. You've got advice to share on how to avoid dental work, right?
Yeah, I mean, I think people like coming to their cleanings maybe, but don't want to come back for any additional dental work to that. I think it's a common goal that people have. Yeah. We, of course, have our standard dental advice that we can give to everybody. But one thing that's nice about getting to know patients is that, I can really find out what their particular risk factors are. And so I can say, all of this advice, this is all a good idea, but this one piece of that is the thing that you really need to pay attention to.
It's interesting to think about dental care in terms of risk factors, right? We think about maybe cavities or gum disease. These are two of the things that you kind of encounter pretty commonly.
Sure, absolutely. There's lots of different things that can cause one person to be more prone to cavities versus another, or with gum disease. Certainly genetics plays a part. Certainly your lifestyle is a big part of that in terms of your diet and your hygiene. But I think the most important thing to know is that even if you do have those predispositions for a certain dental problem, you're not doomed to have that dental problem. So even if you are someone who gets more cavities than another person, you still can get to the point where you aren't getting cavities all the time, but you may just have to do everything else right. You may not be able to get away with some of the things that maybe other people can.
I never in a million years thought that you would be more prone necessarily to getting cavities. So that's really intriguing. Are there things that you do once that's really been identified, if you are more prone, to try to avoid that from happening?
Absolutely. So, when you're trying to prevent cavities, there's always three things you really need to worry about. The first, and I think the most important, is your diet. So whenever we eat, we're really feeding the bacteria in our mouth that are making cavities. And of course, they like sugar the most. And so what we really want to do is starve those bacteria and sort of deactivate them by spending long periods in between meals where you don't have anything to eat or drink besides water. Another really big important part is your hygiene, which I think people know. I like to think about it like this. Your diet is going to dictate whether you get cavities, but your hygiene is going to dictate where you get cavities, because you're going to get cavities where you miss when you brush and you floss. So that's why it's so important to brush for a full 2 minutes and to floss to make sure you're getting those areas in between your teeth that you can't get with a brush. And of course, the last thing is fluoride. So if you're trying to prevent cavities, you just really want to make sure you're using a fluoride toothpaste. A lot of times we'll even use a prescription fluoride toothpaste for someone who is really prone to cavities.
Certainly some terrific insights on avoiding cavities or maybe reducing that risk. What about gum disease? Are there ways to approach preventing that from happening?
Sure. I actually think that the most helpful thing when preventing gum disease is actually just to make sure you come in and get your teeth cleaned on a pretty regular basis. With that, we're really focused on removing the tartar buildup, because that's really what drives the inflammatory process that makes gum disease worse. And so once that tartar builds up on the teeth, you really can't brush it off or floss it off. You really have to have a dentist or hygienist remove it. And so that's why it's really important that we get patients to come in at least every 6 months. Sometimes we'll even have people come back every 3 or 4 months to get their teeth cleaned, just so we can really make sure things stay nice and clean and healthy.
Identifying it and maintaining it and really staying ahead of a problem.
Absolutely.
We talked about cavities. We've talked about gum disease. Are there other common things that you're seeing folks coming to you for?
Absolutely. I mean, we damage our teeth in all sorts of ways. We brush our teeth too hard. We grind our teeth. Some people have diets or conditions that cause their enamel to erode. But, I think it's so important to come in to the dentist on a fairly regular basis, just so we can catch the early signs of that. And that really helps us prevent damage going forward.
I just find it fascinating. You have that great relationship with so many smiles in our community, and you can see those things unfolding as they're happening so everybody can stay on the right track. Thanks for the insights.
Absolutely. Thank you so much.
Yeah, appreciate it. Nice meeting you. Virginia Family Dentistry and Dr. Perkinson.